So would it be advisable to say, within this period, do not, as much as possible, avoid contact with any dead body as much as possible?
Well, I won't say...
We're looking at preventing
I won't say any dead
it.
body because in our own country here, there is no case documented. And I'm sure that
but
if
there are
anyone
cases
dies...
of dengue fever.
A case of dengue fever,
and
case.
The mode of transmission is about the same thing.
About the same thing, yeah.
Okay.
Yeah, about the same thing. But actually, before you can, because you cannot pass just a very generalized statement like that, because when a patient dies, in most cases, you know, this is actually the cause of death. And even with any patient, you use glove and everything, even those that are Muslims that will wash, they will use glove when they are washing, not using their bare hand to wash. And when you finish with that, you have to also do regular hand washing. So I believe that is, you know, what we should do in that respect.
Okay, let's, as we round up, what's the estimated fatality rate of
well,
those who contact? Before
we round up, I would also like to mention what Lagos State has done in this Lagos State Ministry of Health in this respect. We have public health education has been done, you know, using public service announcement. We have done that on some media station to alert the public of the cause of the infection, the route of transmission, and what they should do generally. And apart from that, we have sent fact sheets to the secondary and tertiary health facility, informing them about these, which they are already known again, and also emphasizing more on the aspects of universal precaution. We are also linking with the port health services, the director of port health, because we know that people traveled and they come in through the different ports of entry, so that we will know how to, you know, do active surveillance of these different cases. So and that is ongoing, and then also trying to get the specialized personal protective equipment for the use of the healthcare workers in this respect. So those are what we are doing, and we are still continuing on it, because we in Lagos, you know, Lagos house a lot of different ports of entry through the land border, through the air and you know, sea. So we need to be extra vigilant, and most of the people that travel, you know, the commercial nature of Lagos, we need to, you know, carry out.
Do we have testing points at the entry?
Yes, yes, yeah. No testing point at the entry, because it's not. Basically, it's difficult for you to know, except when you suspect.
So how would you suspect if you do not check? But you
well,
check them.
the only way we can suspect is anyone that has any of those non-specific symptoms and then have one of those bleeding problems. You know, you need to suspect, you know, Ebola virus, even though it might be other form of viral hemorrhagic fever.
Okay. All right, doctor.
So you are talking about, you asked me about case fatality rate.
Yes,
for now. For now, the case fatality rate, at least in Guinea, case fatality rate is 65%. 127, you know, infected, and you have 83 dead. Also in Liberia, you have 8 cases infected. You have 5 deaths. That's about 63%.
Compared to when it was first discovered?
Well, compared to when it was first discovered in Zaire, that one was 88%. You have about 300 plus cases, and you have about 200 and something deaths. That's 88%. It's not as much as then.
Okay. So there's still hope.
There's still hope, but that one too is high.
Do you think the search for the cure has been stopped, or is it still on?
The search for the cure is ongoing. No vaccine has been, you know, discovered yet. You know, there's still research going on possible drug for treatment. But as we are now, what you do normally is supportive.
Are there any vaccines that one can use now?
No vaccine.
No
vaccine documented. No vaccine documented. Even go to the World WHO site, there is no vaccine, and even generally, no vaccine has been, you know, discovered for Ebola virus disease.
What about the dengue fever?
For dengue, I think there is vaccine. I think so. I think there is.
All right, thank you very much. Dr. Ismail Abdul-Salam is a consultant public health physician and state epidemiologist from the Lagos State Ministry of Health. Thank you for coming on the program.
Thank you very much.
Sunrise will be back shortly. We've been discussing the Ebola virus. Please do not go away, as we'll be looking at some other issues.